Alrighty, welcome to the November 17th meeting of Community Resources. Um, This meeting is going to be audio and video recorded. Laura, would you call the roll, please?
Sure. Counselor Clemmer,
Here.
Counselor Perry,
Here.
Counselor Dobbs,
Here.
and Counselor Rothenberg, I don't see, did she? She didn't say she wasn't coming, but okay.
I didn't hear anything. Okay, looks like there's no public here for comment, so just double check. And you're letting Stanley in?
Yeah.
Okay. Okay, so, the minutes of the previous meeting,
It's not, I still haven't gone through the tape yet. I know he sent it
Oh.
to me, but I haven't, it was, but
okay, oh,
924 is.
it was the one for the housing, the combo one?
Yeah, that's the one that's on there.
Yeah. Should we approve it or wait till,
If you're able and willing,
yeah,
that'd be great.
I'll make a motion to approve that.
I'll second it. I looked at it.
and this is for the,
The minutes.
yeah, the joint meeting of the September 24th meeting for the joint meeting with the Housing Forum.
Yes.
Counselor Clemmer,
Yes.
Counselor Perry,
Yes.
and Counselor Dobbs.
Yes.
Thanks.
And are there any updates or announcements from committee members? Okay, next. So tonight, we will be welcoming our state rep, Lindsay Savadosa, and she was here a year ago. And thank you for coming back and making the time to talk to us tonight and tell us what's going on in your world.
Quaverly and Gwen Labad just joined. just
Oh, cool.
Oh,
for
excellent.
information purposes. We've already
Uh,
called the roll, Quaverly, excuse me, but
Great. Well, thank you very much for having me here this evening.
Okay. I just looked to see your microphone was on.
I think so.
It is.
Green. How would you?
You want to just talk about stuff and then we can ask you
Sure,
questions?
Sure, I'm happy to do that.
Thanks.
All right. Well, thank you again for having me here. It's always lovely to spend some time with the counselors and to be counselors I see online. So we are at the end of the first year of session in the House. We are, by House rules, required to finish official business for this first year this coming Wednesday. So it is a little bit of a busy week. We've just learned that we have a few things that are going to be on the agenda for this week. So we're taking up the Bright Act, which is a bill that is going to use some of the fair share money and do some bonding to fund public institutions of higher education. So this is going to be a really important bill for community colleges, state universities, and of course for UMass. And then we will also be taking up the closeout budget this week, which we're really excited about several provisions in that. Perhaps not super relevant to all in Northampton, to the city council per se, but for residents of Northampton, certainly there are the provisions around the Hampshire County Group Insurance Trust, which has been a topic of great consternation, trying to make sure that we're protecting individuals who are within that trust, which has had some financial difficulties. And that we just found out today that Senator Comerford and I have a provision that has made it into the final bill, which will help protect the security of individuals who are going through the name change process. So certainly this protects our trans community, but also victims of domestic violence who want to have that information impounded and protected and not published in the newspaper. So it's going to ease the pathway for those individuals so they don't have to take extra steps and jump through extra hoops. I will say here in Hampshire County, our Register of Deeds has done a tremendous job trying to make sure that that is easy for everyone, but it's not consistent across the state. So we're really thrilled to see that provision make it through. And just as a reminder, the closeout budget is really just making sure we're paying all of our bills for the end of the financial year. So if there were any deficits, we're filling in those gaps. But we have done some extra work in this budget to make sure that we are dealing with some of the impending financial issues that may be before, well, not that maybe, that will be before us. So we know that there are going to be significant changes to Medicaid, for example, which came through in the federal government. We are doing funding. There's going to be funding in this bill that will help keep people on that program to deal with some of the extra bureaucracy that we know they're going to have to go through to keep their health insurance. Those changes start to go in effect as of January 1st, and then they sort of roll out over a period of years. So we're trying to be as proactive as we can as a Commonwealth. We will also be taking up this week a resolution to rescind all prior calls for an Article 5 convention. I know that sounds really esoteric, but what it means is that the Constitution provides a way for the states to convene to make changes or to pass amendments to the Constitution. At this moment in time, we find that would be a very dangerous thing, and Massachusetts has many resolutions that we've passed over the years for various reasons. So we're going to rescind all of those. So we are clear. We are not participating in a call for a constitutional convention to amend the U.S. Constitution at this point in time. So other things may pop up. They often do based on urgency, but that's where we are in the process. Meanwhile, hearings are going to continue for legislation. We're at the tail end, which we're breathing a sigh of relief in my office because with 78 bills filed, it's been a lot of work getting through all of those hearings. We have many bills in Ways and Means and third reading at this point, and we are already preparing for the FY27 budget. So the governor will release her budget in January, and then we will begin the round of Ways and Means hearings and again go into House budget in April, Senate budget in May. And I know it seems like we don't want it to be the holidays in the new year yet, but this is really the time to start advocating for priorities for the FY27 budget. We expect that it will be a tighter budget, and we don't have consensus revenue yet. We know that the state's economic outlook at the moment is not terrible. It's not growing, I think, at the rate we would like it to, but we're not in the negative. We're not in a recessionary territory. But what we are anticipating, and the reason that I say it will be tighter, is that we know the big, beautiful bill that was passed in Congress is pushing more costs onto states. And so we know that we're going to have to pick up more cost for Medicaid. We know that it's going to change the way we make our health safety net contributions. We know that it's going to change even just the administration of the SNAP program. More of those costs will fall to the Commonwealth. And so we need to be able to absorb those and really understand what that full impact will be. Because again, with the way that bill was phased, it doesn't all happen on day one. It happens over a period of time, but we do need to be ready. And of course, we understand that there are rising costs and rising needs, and we're trying to meet them as best we can. So it would be, of course, always wonderful to hear from any counselors or member of the public who want to say, like, these are the things you need to be thinking about and you need to be prioritizing. That's just a very small snippet of some of the work, but happy to delve into any details you might wish.
Councilor Moulton, feel free to jump in too.
Oh, I can't quite hear you, Deb.
So my microphone wasn't on.
Oh, sorry. There you go. Thank you.
Thank you. Yeah, Councilor Moulton too, if you have questions, feel free to jump in. Jeremy, Councilor Dubs.
Sure. Yeah, I was curious about we had the city council had passed a resolution not too long ago about an act establishing the bill, which is called an act establishing Medicare for all in Massachusetts, and we passed that unanimously. And I was curious if you had like any updates on that or any thoughts on like how you think that is going, or like the probability of that passing in Massachusetts.
So I appreciate the resolution. It is a bill that I file, so thank you for the support. It really does matter, and I think it matters that Northampton is supportive, but we need more and more communities to be as well. I will say it's a tricky bill this session only because the bill, if you read the whole thing, is very prescriptive about the financing, and of course we're in a moment where the federal landscape is changing for both Medicare to some extent, but mostly Medicaid payments. So we're in really good conversations with the chair of the committee about how we could get something where we're looking at how we rewrite that financing component to reflect the current realities that we're living in. I think we all feel that we are on a quick slope towards a single payer system, because the current one is absolutely not working. So I can't give you, yes, it's going to be this term, but I will say that conversations have become deeper and more complex as we try to figure out how one handles the financing piece. And just the other day, there was, they sort of call it like the Super Bowl of healthcare, where they had the Health Policy Commission come together with all of the key stakeholders in healthcare, and they talked about cost trends and where we're headed. The state sets a benchmark for rising healthcare costs. I think it was, I'm going to get it wrong, but I think it was 3.6%. I might be off by a point percentage, but the healthcare costs were at a much higher rate. So we're clearly not meeting benchmark. We're not finding solutions in our current system to keep those costs down, and we are looking at all options.
Wonderful, thank you.
Thank you, and again, thank you for the resolution.
Of course, yes.
Garrett?
Yes. Well, thank you for coming again. Always a pleasure. I know that last time you were here, you were talking about, I think, the maternal health
Yes,
bill, and I know it was passed. And
it was.
uh, has there been an impact for that? It was, you were excited about it. I was excited as well. So that's my first question. How has that been going? And is there any, with the current landscape, how do people feel about?
So the maternal health bill is definitely in implementation phase. There are so many pieces of it. I don't think your meeting is quite long enough to go through all of them. But I will say there is now the midwifery commission that is meeting within the Department of Public Health. They are working on regulations to make sure that we have certified public midwives, the way the bill had set forth. We are doing work around coverage of lactation consultants. My piece of the legislation was around pregnancy loss. The Department of Public Health, you may see the signs out and about. There were actually a couple along the Mass Pike, which I did not stop and take a picture of, but I really wanted to. They've launched a campaign called Count the Kicks. So it helps people later in pregnancy determine if there are any issues with the pregnancy, because the number of kicks you feel during a day can be indicative of whether or not there are problems. And so there's a lot of work happening. The small issue that we may face, and we're hoping that this is not the case, is of course the implementation work does require funding, and so we are trying to understand how we can continue to fund all of this good work. And keep mothers and babies safe. We have the infant fetal mortality commission that is up and running as well, and that's also really exciting. And I think will be generative of future legislation as we understand what problems people are facing.
That was exciting because Cooley Dickinson has a wonderful midwifery program, and both of my kids went through it. And I actually ran into someone from my first kid group this weekend,
yeah.
and it was nice. Our kids are big now. Another question I had, though, is kind of forward thinking, or we're looking at our budgets, and I know that there's a movement to address marijuana sales.
Yes.
I know there's a ballot question that's going to come up. If I may ask,
Yeah.
how are folks feeling about that? And is there any kind of planning as to what to do? Because once those funds go away, I worry about how we're going to make up for that loss.
So I will say I'm not as familiar with the ballot question. I know it has something to do with THC levels, but I don't know the details of it. No one has approached me about it or talked to me about it. So we will deal with those things as they come along. The House did pass legislation around cannabis. It's more around the Cannabis Control Commission earlier this year, and sort of changing the way that it's configured, because we've heard time and time again that it is really hard to get an answer and to get things to move quickly. So we're trying to actually narrow it down, change the appointing authorities, make it a little sleeker, but hopefully easier to work with in the process. One of the pieces of that legislation that I am really glad we passed, because I heard from a lot of pediatricians, was actually regulating currently unregulated beverages that have really high levels of THC. They don't fall under the Cannabis Control Commission because it's not marijuana, but I believe it's hemp that they're made from with high THC levels. And so for the first time that would be regulated, and I think really important. I know that the Senate is going to take up their own version of that bill very shortly. I forget if it's forget if it's this week or it's just on the docket, but I do think it's coming up quickly. We saw notice of that last week. So that will go into conference committee, and it's a really good time to weigh in and tell us like what provisions you think are better. But the ballot question, if they get enough signatures in this first round, they have until Wednesday. It'll all come before the legislature, and that's something we've been trying to stress with people. This first round of ballot question signatures is really to just like see, does it rise to the level where people of the Commonwealth are interested? Then everything comes to the legislature. We decide whether to take action or not. If we don't, it goes back out for more signatures and then potentially to the ballot. So it will be interesting because I have not heard the official comments about the ballot question, but I was knocking on doors for other questions this weekend, and many people had very strong opinions about it. They brought it up on their own. So I've only heard that anecdotal information.
I'm intrigued to know more. when it
Yes,
comes to
yeah.
that.
I think it's always good to get the official camps to come and talk to you about what it is, though. No. No, please. I'm happy to answer any questions.
I was trying to find, I know you got us some money recently for, I didn't write down what it was, but I'm sorry for that.
That's
Not
okay.
taking better notes, but thank you. And could you just tell us what that was?
Do
Recently?
you have a round
$50,000?
in?
No.
Is that what's on our website? There's something on the website.
Yeah,
That's
probably is that.
Has something to do with storefronts, vacant storefronts.
Yeah.
The
Yes,
vacant.
thank you.
Yes. So I will thank you. I
Mhm.
appreciate the things, but
Mhm.
that is not me. That is the city of Northampton proactively applying for a grant program through the Office of Economic Development. The $50,000 is through the vacant storefront program. I believe Northampton has applied before, and it helps to make it a little bit easier for businesses to start up in the community. I would definitely, I'd give praise to the mayor for doing that and check in with her office about their plans for using it. It comes through the Community One Stop grant, and I think both Williamsburg and Northampton in my district got that grant. So we were really pleased to see that. And it's really, I know I said this the last time I was here, but it's really, really great to see communities proactively going after these grants. The Healy administration has tried so hard to make it easier because grant writing is hard and cumbersome and very time consuming. So they've been doing a lot of apply for what it is you think you need, and we'll point you in the direction of the right grant so that you're not mistaking forms or anything like that. So I am glad to see that money coming into Northampton, and we've seen a lot of money coming in from different grant pots for the schools as well, which is excellent, and we hope that it just continues.
Yeah, thanks for the explanation. And then you just said that with SNAP, that the Commonwealth has to pick up more of the administrative
Yes.
fees. So, I mean, is that a tactic they're using for other things as well? They're giving the money, but now we're absorbing a lot of the costs that we didn't have to take on before?
So I don't know. So it is definitely a tactic with SNAP. I don't know that I would want to generalize that more broadly. There are many programs that the federal government pays for and then states administer, or the federal government contributes funds for and the states administer. With SNAP, the question is really very complicated. We are going to be taking on more of an administrative fee, but the amount of that fee is based on our error rate as a state. It was a negotiation tactic. There is always some, I think you're in government, so there's always some level of errors that occur because we are human. And so states that keep that at a very low rate will take on less of a fee, and states that have a higher rate will take on more. And so we don't really know what that cost will be because of that. We can sort of look historically at where we've been, and we can, of course, look at ways to try to improve that. I mean, I think from the Commonwealth's perspective, it has long been an issue for us. And I guess I'll say for the legislature, it's long been an issue that we think that there need to be more DTA caseworkers. DTA, the Department of Transitional Assistance, administers the SNAP program. And we know that wait times are very long, that people have a hard time getting a call back. I will say I've had to work closely with DTA staff, so I know they're trying really hard, but their caseloads are far too great. So it's a question for the state of how do we balance more administrative costs falling to us, but also already having needs where we needed to expand the program. Also, the number of people who qualify and the number of people who need food assistance is increasing in all of the counties in Western Massachusetts. The numbers are stark and sobering.
Yeah, it's pretty sad. And uh, Director O'Leary said that the biggest growing population of houseless people are the elderly now.
Yes. Yes.
which Is pretty horrible, you know, your golden years, and
Right.
don't want to spend them that way.
And I think a really horrible fact indeed, and a really good place where the state and municipalities can work together, because I know we hear from senior citizens regularly who feel like they're being priced out of homes that they've already paid for simply because property taxes and home evaluations are going up. And I don't have a easy answer or a magic wand for that, but I do think that we need to hear from the municipalities. How do we balance, of course, the need for funds coming into the cities, but also how do we keep our residents in their houses and taken care of, and feeling like they're valued parts of the community? Because when you get a property tax bill that you can't afford, it's really hard to feel like you're a valued member of the community, right? It feels like you're being pushed out. And I think the state does need to engage more with the cities and towns to figure out how we come up with solutions. We've had, we've done more around the senior circuit tax breaker, which is a refundable tax credit for seniors. So like, even if they don't pay taxes, they get money back. We've tried to increase the amount of senior tax write-off, but I know that those programs can be very complicated. And I do think we've sometimes forgotten that we need to center sort of dignity and respect for our seniors when we're talking about that. No one wants to feel feel like they're made less than because they need assistance at that point in life, and we need to do a better job.
Yeah, and if you can age in place too, you have your community, you have your neighbors that check on you, so
Yes.
makes sense for for people to stay where they are, if they can, and for us to help them as much as we can.
Yeah.
Because we're all going to be there someday if we're lucky. So Gwen, Navad.
Hi, everyone. Lindsay, thank you for coming tonight. So I am wondering if you or anyone can tell us with the housing, well, I'm calling it the housing bond bill, but I mean, but there was a certain amount of money that was preserved that was set aside for preservation of public housing. And I'm wondering, like what's going on with that funding, how it was distributed, or how they were determining which communities would get it, and things like that, because there are like still some lingering issues that haven't been able to be addressed in public housing. And I figure this is a state question, and I get this question all the time. So I'm wondering, is it too late? Is there something maybe residents can do to take action in hopes that, things can change? Thanks.
Sure. So I just want to sort of set the stage to my answer by saying that I think the legislature was well aware that the amount of need in public housing for capital improvements far, far, far outweighed the amount of money that was in the bond bill. In fact, I think we were given a number at one point that was several $billion. And of course, the whole bond was several $billions, and it dealt with a wide range of housing issues. So I want to say that to begin, to just sort of underscore, like, there is by no stretch of the imagination enough capital within this bill to address everything. Now, that said, the housing bond bill was passed at the very end of last session. And then, of course, the financial outlook in the state changed. So we've been working closely with HLC to really say, like, all right, well, when are we going to start releasing some of that money? And they've been doing it pretty slowly. I think out of an abundance of caution, because no one wants to release money that then you find out that you don't have later. And when a bond, is a promise, it's an authorization that the governor can choose or choose not to release. But when HLC actually spends that money, that is real dollars that have to be behind it. So HLC only very recently put forward their capital improvement plan, and that includes how they're going to spend their actual budget based on the bond bill. So I have not yet received from them, this is how we're going to distribute money to various housing authorities. That's something I'm happy to track with them. And to, of course, make sure that Northampton and the surrounding communities get their fair share of that money, because we know, I mean, as you know, I visited all of the properties, and they are in desperate need of improvement. So we'll keep tracking it, but I just want to stress it's been really slow. And I know that's frustrating, especially if you're one of the people who is sitting in your home going, wow, this really needs to be fixed immediately.
Right. Thank you so much. And yes, it was so much less. And then things, inflation was happening. And so anyway, thank you so much for that.
Thank you.
Counselor Moulton.
Thank you, and thank you, Representative, for being here again. I wanted to ask about your assessment of where the 3 home rule petitions are in terms of closeness to the finish line that are lingering from the charter review that we did back in 2019. Those are, and hearings have been held in the last couple of months on all 3 of them. Those are ranked choice voting, vote 16, and non resident non-citizens allowing to vote in local elections. It's now 6 years later, and the city council earlier this year reaffirmed our support for all 3 of those, and I know you've been very supportive of them. How close do you think the state is to any of those?
So if I were going to rank them, not using ranked choice voting, just ranking, I would say that we are closest with the ranked choice voting, followed by vote 16, followed by allowing non-citizens to vote in municipal elections. The last of the 3 has had pretty significant negative feedback time and again based on the state constitution. There's just a lot of folks who say you cannot do that. Vote 16 has tremendous and wonderful energy behind it, and I do think that we've seen this happen in other places. I think that we will get there, but it is a harder lift. But ranked choice voting, I think we are going to turn a corner. I don't know if it will be this session. We got so close one session. But I think, we were able to talk this year about, first of all, savings to communities who used ranked choice voting. We talked about how it worked so beautifully over in East Hampton. Of course, it was the New York City model that a lot of people paid attention to, so it was more on folks' radar. And the challenge, of course, is that it lost at the ballot, and that is kind of where things stand, where people say, well, voters said that they didn't want it. And we are really trying to make the argument in Northampton that wasn't the case. Voters did say they wanted it, and we're only asking to do it here. So I think that we will get there, whether it's this session or next session. I do think we've come around again to where it's reasonable for the state to allow us to move forward.
Well, that's good to hear. I hope so too. And I know that Northampton in particular on ranked choice voting and vote 16 has been very well represented at those hearings. And I appreciate again your support for all 3 of them.
Yes, and I will say, especially, the Mayor's Youth Commission, the folks they're so passionate and eloquent, and they come into the State House and they really underscore why that home rule petition is so important. So I do think that their work should not be overlooked.
Counselor Perry.
Go again. So, one of the things I love about having you join us is just hearing all the wonderful work that you do. But I also like to ask,
Yeah.
Is there things that we could do? I know that there is a Chapter 70 listening session happening tomorrow,
Yes.
which is virtual, so folks can help, push for change on that. But is there anything else that should be on our radar, or ways that we can also help you?
Yes, I would say it would be great if people could, whether they can attend in person or send written testimony, please do so around the Chapter 70 issue. it is a complicated question, and I think the state needs to hear from us. And superintendent has already submitted her testimony. We've had testimony from members of school committee, so the more the merrier, quite honestly. We are getting towards the end of hearings for bills, but I will note a couple, just some of my favorites that we've got towards the end. So we actually have a hearing on Wednesday in the Housing Committee for a piece of legislation that would ban algorithmic rent fixing. Now, you can all wonder what that is for a second. So algorithmic rent fixing is something that we're seeing spread across the state, and it is where companies use technology to gather all of the rents, and then they help landlords set a minimum rent. So it is a form of collusion. So you never charge anything below what the lowest possible rent is. So it is a way of driving up prices. And in fact, if you search, you will find that the Department of Justice has sued and won in many cases where we've seen algorithmic rent fixing. It was banned very recently in New York State. There's a bill in New Jersey, and we're hoping that Massachusetts will also join in on that. I also, you'll see a theme around technology and privacy here. So I also have a bill that is currently in the third reading of the House around banning grocery store surveillance pricing. Massachusetts has long not allowed electronic price tags, which are necessary if you are going to do any sort of surveillance pricing. However, we recently changed that via the regulatory process with the Division of Standards. So stores will be allowed by right to have electronic tags. We have seen stores, I won't name names of stores, but we have seen stores experimenting with surge pricing at grocery stores, and then changing pricing and or offering discounts based on the biometrics of the customer. So we want to prevent that in Massachusetts, and we're really excited that that bill is a first-time file, is in the last stages of the legislative process. So that's exciting.
Mhm.
Yeah.
Okay. Anything else from, any other questions for Rep. Sabadosa?
Thanks for coming, Lindsay.
Thank you so much, Councilor Rothenberg.
Anything else that we should know about, or we can?
Not that I have off the top of my head. I could
Mhm.
probably talk to you for a long time about everything else that's going on, but
Yeah.
I will be respectful of your meeting.
Mhm.
I just hope, all counselors feel that they can reach out at any point. Your comments, your input are always welcome, and I hope that you view me as a resource to help solve problems for people in our community to the best of our ability.
Thanks. Anything coming down from the federal level that we should, that you haven't mentioned already, or like, who knows?
Not at the moment. I guess the only thing that I would note is that the continuing resolution did only move everything to January. So that's important to watch for. I certainly hope we don't have any further shutdowns, but I do think people should keep that on their radar. I will say, the issues around healthcare are going to be significant. The first Medicaid change that goes into effect is on January 1st, and it will remove healthcare coverage for anyone who is a non-citizen, irrespective of their immigration status. So doesn't really matter if you are lawfully, well, only people who are lawfully here are allowed to have Medicaid, but it doesn't matter if you have a green card or what your status is. If you're not a citizen, you will no longer qualify. That's going to mean about 36,000 people in Massachusetts will lose their health insurance right out the gate. I think it's important that we continue to talk about this and understand what that means, because that means busier emergency rooms. That means, people who waiting to get care for chronic conditions or really just anything because of cost factors. So I think that that's important. I think it's also important for us to know that even though SNAP is back and is funded and people are getting their benefits, if people are going through recertification, all of the work requirements that the federal government put into place and additional bureaucratic barriers are starting to be implemented. So it doesn't affect people right away, but it does start to affect new applicants. And I think that's going to be important because it will mean more people within the state need our help. And then I think just finally the biggest thing, and I don't think anyone here is surprised, is housing. We are seeing higher and higher usage of the RAF program, which is assistance if people are falling behind on their mortgages. We're seeing people on their rent or their mortgage. We are seeing more of those cases. And I hope that whether people reach out to you or to me, that we're all connecting with them with those services as quickly as possible and trying to be as proactive as we can. So we will not have all the tools necessary, but we'll make use of the ones that we do.
Thank you.
I s-
You have time for another,
Of course.
Gwen?
You may or may not know this, Lindsay, but I'm thinking you do, is what are these work requirements? And does volunteering apply to these work requirements? And hopefully this doesn't happen, but at the same time, like, what can people expect?
I don't believe that volunteering would necessarily apply. And I don't want to say too much only because I don't want to misspeak and then be on the record as having said the wrong thing. But I'm happy to provide that information in writing if you'd like so that you can share it with people. Some of it changes based on age as well, or the age of children in the home. And so I can give you all of that specific information that you can feel free to push out to your communities and networks so that everyone is really, really accurate about what they're seeing. I will say one thing that I worry about constantly is I don't want to be fear mongering. Like there are a lot of bad things happening and it is hard and we should be aware, but we should also just be aware of the facts, right? Like I don't want people to think all of my benefits are going away. That's not true. The services still remain in place. It's just going to be harder to access them. And we want to figure out as a state how anything that we can do to make it a little bit easier so that we keep people on those services to the greatest extent possible. So I will provide that information in writing and I'll avoid, any fear mongering on my end for today by misspeaking.
And last time you said that, or it came out that people should not close out their accounts, just keep, $1 on it if you have a SNAP card and,
Yes, although
so it's easier. Yeah, but if it-
their benefits should
Mhm.
be there in full. The
Yeah.
state is continuing to provide, and the reason for that was because the state continued to provide the healthy incentives program. So you even as we were able to do it with even a penny
Mhm.
on your card. So if you had that penny, you got your 40 or whatever allocation you get. Sort of depends on your family size for the healthy incentives program. So you did have that ability to continue to buy, fresh fruits and vegetables and meats and things from your local farmers. And I just need to also say Grow Food Northampton did an amazing job with continuing to give people a match, even if they didn't have any money on their card to match, so that they could continue to shop.
Yeah, it's a great organization.
Yes.
Anything else out there or here? No. Okay, thank you so much for coming in and really you always have so much information and appreciate you spending your time and all the work you're doing for us over here. And we're very lucky to have you to represent us.
Well, likewise, I'm very grateful for the council and all of your work.
Thank you. And my cheat sheet. Okay, so there's no items referred to the committee. Any new business? Okay, you can get a motion to adjourn, please.
We'll move to adjourn.
I second it. So Quaverly's here instead of Jeremy. Could you do a roll call, please?
Councilor Clemmer,
Yes.
Councilor Perry,
Yes.
Councilor Rothenberg.
Yes.
He told me he was going to. Okay, the meeting's adjourned, and so far there's nothing planned for December, so this will be the last meeting of this term unless something comes up. And okay, so stand by on the December meeting. Okay, everybody have a good holiday and see you soon.